all know this is Dental Awareness Month, and we have Dr. Nisha with her team live from her clinic.
Welcome to Smile Ranges Dental. Here we are, Dr. Nisha Sundargopal and Leah Sadhu want to give you some tips for this new year. We're going to have to keep our teeth healthy. A good oral health is a good overall health. Brush 2 minutes a day, twice daily. Leah, can we repeat it? 2 minutes a day, twice daily. 2 minutes a day, twice daily keeps your teeth healthy. It's simple.
Welcome to the show, Doctor. Hello.
Hi Rashmi. How are
I'm good.
you?
I'm so
Welcome
happy
to
you have
Smile
taken out
Rangers
your time to be
Dental.
part of our show from your clinic. I have such a busy routine, I know. And kindly introduce your team also, please.
Yes, welcome to Smile Rangers Dental. This is my office here today. I have my team Smile Rangers, my manager, Miss Junie Garza.
Hello,
She's
how are
here.
you?
And then we have John here. He is with the teeth. He's our model patient today. So we're going to go over with a lot of tips for the Dental Awareness Month in February. Dental Awareness Month in Feb is a National Children's Dental Health Month. So that is why we chose this month to do our show with Rashmi ji and Janak so that we can present a lot of tips for our My Dream Entertainment viewers.
Thank you so much. Thanks a ton, and welcome to the show again. And kindly, I have a request. Kindly fix your like little bit of position on one side because our viewers want to. No, this other way. Yeah, and yeah, look in front of the camera. Yeah, that's important. So that's great of you, Dr. Nisha. I know you have such a tight schedule and you have taken out time with your team. Thank you so much again. I have a lot of requests, I should say. Every day, people have been asking me that when this show is coming up, and please request Dr. Nisha that how should we brush our teeth. So please, it's a request from all our viewers. So kindly let us know about that, please.
I know we've been talking about brushing for some 2 or 3 episodes, but now I have like a jumbo model. Even though we have a little model, like a little teeth model, we have the other, the big Mr. John, the baby John, the monkey John. So we're gonna teach him how to brush the teeth today. Okay, so
Okay.
it's his first visit, and Miss Junie is gonna kind of get him comfortable at the office, right? So now we're gonna say, "Hey, Mr. John, hi, sweetie, hello, how are you?" And then we're gonna be like, so it's John's first visit to the office. Today we actually had a girl, she's 4 years and she had never visited the dental office.
Okay.
And we wanted to make her visit the best. So we brought her in and we made her visit like the most memorable one.
Okay.
So today John's here. So we're gonna say like, high five, John, high five, high five. And then we're gonna go like, okay, can I see your teeth? And then we're gonna check the teeth.
Okay.
And we're gonna teach him this is how we brush our teeth, go up and down,
Okay.
and then go rolling. And then John's gonna go rolling, and then go brush, brush, and then we're gonna go brush, brush. And then what we
Awesome.
do is we give the kids this brush
Uh-huh.
and the little John,
Okay.
and then we have them brush John's teeth.
Okay.
So that way, it's like a show and do technique,
Mm-hmm.
and then we do modeling. So we take John as a model, and we kind of make sure that the fear is gone because a lot of times the dentistry is all about removing the fear. Once the fear factors is removed, then we will be able to have more patient cooperation as far as the kids. They have to be really cooperative for us to do a good cleaning, flossing, and if they need fillings, then we can do cavities on them. So I want to ask a few questions to Junie right now. So Junie,
Sure.
so what was your experience like when you were a kid when you first went to a dental office?
My experience was a little bit of fear,
Uh-huh.
mainly because of the injections.
Oh, yes.
I had the
Yes.
fear of getting the injections.
Uh-huh. And then, so like when you went on the dental chair, were you worried about going up and down, going back and forth?
Not really. I was just mainly, I had that fear of the pain of it having that pain of the injection. But once the doctor started to talk to me, they made me feel comfortable, made me feel at ease, then it kind of removed the fear from it.
Nice, nice. So Rashmiji, did you hear? So
Yes, yes, of course.
that's
What she's
most
saying, I
patients
totally
have that
agree to
problem.
that. So
So
much
that's
of
why,
fear. But thank you so much. You are such a sweetheart, the way you deal with people. I'm so happy. Like, you are such a nice person. I know you can make kids comfortable and they would love to come to Smile Ranger Dental. And when they go out of your clinic, they're always smiling. They're not crying. So, how does this insurance thing work? Like, we would like to know about that.
yeah. So Junie is my billing expert,
Okay.
and she's my manager of the office. And I have also Ms. Miros, who is also a team lead, and my the other part of the managing clinical office. So she manages all the finance part, and she is the expert to talk more about insurances. So that's why we brought her in. And then when we so on insurances, Junie, I want you to explain to our viewers what are the different type of insurances that are available.
Okay, well, there's actually several different types of insurances available. Here in the state of Texas, we have the Texas Medicaid and CHIPS program. That is a very large program. Pretty much the parents with lower income are able to get affordable dental care. We also have the standard insurance either through the marketplace or through the employers, which are the PPO programs and also the DHMO plans.
Okay.
Plans are a fee for service. So whenever the patients come to the office, anything that is billed to the insurance is the same data service. DHMO plans are a little bit made a little bit more affordable for the patients with smaller co-payments.
Okay.
So the patients come in and follow specific co-payment schedule to get the services.
But many a times, what happens with the health maintenance organization, the dental health maintenance organization is the DHMO.
Mm-hmm.
And what it does is you have to go the doctor in the network.
Okay.
And you might not be able to find a doctor in the network within the mile, 2 mile, 5 mile, or 10 mile radius from where we live. So more of a PPO plan, it actually helps really well for these patients because you can go even out of network and take care of your teeth. Because DHMO plans, even though certain times they come up with like saying there is no year-end maximum and the premiums are lower, but sometimes it has issues. But it's again how each patient's teeth are. If they have very less treatments that's needed, then they can use the best benefit with the DHMO plans. And it's like there are so many options available out there. And many offices, they like the fee, just the plain cash fee for service, because that avoids a lot of restrictions sometimes the insurance is put on these patients. Because say for example, if the patient need implant, many a times most insurances will not cover an implant.
Okay.
It can cover a crown on the top of the implant.
Mm-hmm.
An implant is a screw, that is a metal screw. Say, for example, if a patient loses a tooth, then they're going to put a metal screw on the jaw. So I want to show you how we're going to have John sit down. So I'm going to show you. So if you really look into this, can I see? Are you able to see it?
Yeah.
Do you want to change the angle, Mr.
Can you make the
Jonas? So
laptop
can I?
little bit on your side, Dr. Nisha? I think so that will be in the front then. Can you move it on your side, the laptop you have, the camera? If you can make it right in front of you, will be great if you can. Oh
So
yeah,
I'm
that's fine. We
facing
can
the
see it.
laptop right,
Perfect, perfect.
the webcam. Oh, okay. I forgot.
Okay,
I'm in the wrong position
okay,
because
I
I have a
got it.
different
Yes,
camera.
yes, perfect.
Very tricky.
Perfect. We can see that.
Check if you can see it better,
Yeah, yeah,
like that.
perfect, perfect, Dr. Nisha. Thank you so much.
Okay. So that's the view. And if you really see on this one, the bottom part of it,
Uh-huh.
you see the red dots and there's this metals.
Okay.
So those are the implants.
Oh.
So what implants does is when you lose a tooth and you have to basically, if there is no tooth, the metal part, we place a screw in the jawbone
Okay.
and then the crown goes on top of it. So
Okay.
I'm going to show you how a crown looks like. So this one. So this is a crown.
Mm-hmm.
So this part is a crown.
It's okay.
Crown fell down. So, but let's go with the jawbone.
Okay.
So basically, on the jawbone, it is placed in the jawbone. It's a metal screw.
Okay.
So what we do is say if there is no tooth
Mm-hmm.
like this.
Yeah.
Say for example, if you see there is no tooth.
Correct.
So in that spot, so then we put the little screw
Okay.
and we put the crown on. But you see how those crowns are very tiny. When I was trying to hold it, it
Yeah.
just falls
Yeah.
off. So we try to cement it, or we try to put a screw on, and then we try to retain it into the implant, into the screw of the jawbone.
Okay. Perfect.
So
Perfect.
if there is a missing teeth, like that, and then you can get an implant and replace the tooth. So insurances do not sometimes cover these implants. So when that
Yeah.
happens, then we switch to the fee for service, and we give them a price, a cash price,
Okay.
and we so they do it out of pocket, and then if their insurances covers implant crowns, and they use their insurances to cover it. And nowadays that is why pre-existing conditions are very important.
Mm.
And you hear all politicians, the president, talk about
Yeah.
pre-existing conditions, and Affordable Care had removed pre-existing conditions, and I'm glad the new government is trying to keep it. Because if there are pre-existing conditions, for example, if they had lost their tooth before, say 10 years ago,
Mm-hmm.
and that is a pre-existing condition, and if that is there, then this implant crown will not be covered with your insurance.
Okay.
Imagine to pay your premiums, and then you have an insurance that does not cover your implant. So what happens, right? So then you have to pay out of pocket.
Yeah.
So that's why a lot of our providers like us, we try to keep it very affordable, and to try to prevent the middleman, which is the insurances. Sometimes that is a little difficult in some conditions.
Yeah.
And one of our goal as providers in the long run is to have every dental cover procedure covered by an insurance, not exceptions, so that if they're covered, the patients can get it covered and then get some copays paid along with it, so that the treatment is not skyrocketed price. It's very affordable. So my best suggestion would be like, the Affordable Care Plan. They're trying to make it affordable, but then all the dentists and all the healthcare professionals are trying to give our patients the best dental or a medical cost, so that it is, what is the point of us learning all these clinical skills when we cannot have the patient benefit from it?
Of course, yes. But how the cash thing works, like you are saying, they can give some cash optional. So is it a monthly payment plan you have, or one time they have to pay? How does it work?
Yeah, so Junie can explain to you about how she plans a payment plan, so that way then I can pitch in some more inputs on
Okay.
it.
So as far as for our cash patients, certain procedures are done same day. So same day procedures, a lot of patients pay up front, but we have different financing programs like Care Credit that offers the patients different promotions to be able to get the treatment done, and they can pay back in monthly payments.
Okay, okay. Perfect. That is really a great information for all our viewers. That will be fantastic, actually, because when the pain is there or anything is bothering you, it's like, I think so, any pain you can take, but not when it is in your mouth. It's so difficult, and especially
Right,
the
right.
tooth. It's so
Yeah,
like
it
you
is
have to
hard,
go to
and
a
it's
dentist,
just like,
no
we
matter
have.
what. Yeah, you have to go to the dentist. I'm saying no matter what, you cannot
Yeah.
stop at home. You have to visit for sure because it's so painful, of course.
Yes, and it's sometimes like you have a pain in your teeth, and then you want to get it treated. Then there is all these different options that's available, but then if we cannot afford it, there is no point of it.
Right.
And so I want Janak to play the next video, which is the microscope video, so I can talk a little bit about the root canal
Sure,
treatments.
please. We'll run that.
So the one machine that I'm using is a
Mm-hmm.
microscope,
Okay.
and we it's like a microscope. We see the enlarged image of the tooth,
Hmm.
and through the scope. But this is a dental microscope,
Okay.
and we see the tooth and the roots and canals inside the tooth,
Hmm.
and then we take care of the infected nerves.
Okay. All right.
So the root canals are some treatment whenever the tooth has a lot of decay
Mm-hmm.
and the nerves are infected. If you look into my model here, if you really see on to this,
Yeah.
there is red lines.
Mm-hmm.
Those are the roots of the tooth, the
Okay.
nerves.
Mm-hmm.
And the red line gets infected. And what happens is, if you really see on this, on the jaw, the bottom of the jaw, where the black line and there's red balls, that is the pus.
Okay.
That's how the root accumulates pus.
Okay.
And once the root accumulates pus, it gets like really decayed and destroyed, and that's how it starts hurting because the nerve vessels have been damaged.
Oh.
So once the nerve vessels are damaged, then it causes a lot of pain.
Mm-hmm.
So when our front desk takes the call, the moment we hear the word pain,
Hmm.
they're trained to ask them, are they in a lot of pain, and do they want to be seen right away?
Mm-hmm.
So, and that's the first question. So, if they're either patient of record, and it's a new patient, or it's a patient of an existing record, meaning it's our regular patients. If they are in pain, any doctor as a clinician will right away take them in because that is our duty and that is the oath we take to make sure our patients are free of pain. And root canal is such a blessing to remove all the pain on the tooth by removing the nerve.
Okay.
And once the nerves are removed, the tooth is such a free bird. And then we just put artificial rubber like material inside the tooth,
Hmm.
and then we put a cap on top of it. And that's how it works. And those root canals are such a blessing because the pain is removed really right away.
Of
Junie,
course.
can you tell me some experiences with root canals about when you see patients?
Well, some of the experiences, first of all, what I wanted to add as speaking to the patients
Mm-hmm.
whenever they call, one of the biggest issues that I do see with patients is that they hold back from coming in because they're afraid of the cost.
Yes.
So, for with most patients, consultations and emergency visits are very
Mm-hmm.
affordable. So, I always urge for a patient to see a doctor immediately. Uh, because of the risk of them having an infection. Tooth infection can actually be very dangerous
Mm-hmm.
for a patient, and I'll actually let Dr. Sun talk about how dangerous, a tooth infection can be for the patient.
Yeah, right.
But most dental offices, at least the initial coming into the office is the first step. So I always explain to the patients that it's never too late to see the dentist.
Yeah.
As long as you come in, that's the first step in trying to get your
Correct.
teeth and your oral health care started on the right path. But as far as with root canals, we try to urge all of our patients. It's really important for them to try and keep their teeth and preserve their teeth as long as possible.
Ah, yeah.
And root canal treatments, we have a lot of patients that are actually all about trying to preserve their teeth now. They see it as very important and they're taking the steps needed as far as looking at different finance options and everything to get the treatment taken care of.
How many
Thank
sittings are required, like when we do this procedure?
Pardon,
For
Rashmi?
root canal, how many sittings are required?
So root canals can be done usually in one single visit.
Mm-hmm.
And single visit root canals are the most common procedures nowadays. But if the tooth is really infected,
Mm.
then we do it in two sittings.
Okay.
And that's the usual protocol. And sometimes we might end up doing like a calcium hydroxide, like a temporary dressing in the root so that the infection subsides and then we will change it to a permanent filling. So it might be like a single visit, two visits or three visits. We some complicated tooth general dentists, we do refer them to the specialist because we want to make sure that the patient is in the best care. If general dentist cannot one person cannot do it all because they're not trained on that particular type of situation, then we definitely send them to a specialist, and the specialist will take care of the patient. And then we bring them back, and then we put a cap on the tooth. So that's how the root canal treated teeth are saved. And Judy brought us a good point about talking about abscesses. So the abscesses on a little kid, they are very life threatening. Next program, we will present to you my big board where I presented in Boston University the study that we did and research part where we did the how many hospital visits patients can end up in life-threatening emergencies just because of a tooth abscess. So on kids, a little abscess is very, very dangerous. And like I said, so this is like the jawbone, right? So and the nerve from the jawbone actually starts all the way here, like from inside, and it runs around all of that tooth. So this is how it is. It this is called the inferior alveolar foramen, and then from here it actually goes all around. There's two nerves, one from this jaw side, one from the other jaw side, and they provide. This is like a jaw without teeth, but they will provide. This nerve provides all the teeth, and if the nerve gets infected, it can really carry these things, the infectious toxins, to the brain. And especially when it goes on the top tooth, we call it as the danger area of the face over here. Okay. In this area, and so they can really touch, go into the nerve, into the eyes. It can reach the brain, and so those are the risk problems because of the bacteria and the toxins can really affect children. So it's very important that we take care of these abscesses and we get treatment right away with the patient. Yeah.
Thank you, Dr. Nisha. It was really very informative session today. It's great. But before we end the show, I have a question. We have a lot of questions. Actually, we need to start our call sessions also. We should take some calls during our show because so many people are curious to ask you so many questions. But one question is is requested to me that please ask that one of the mothers, she called me that her son is not brushing his teeth and only is doing mouthwash. So how safe is it? It is, he's saying oh mom, I'm doing mouthwash and I'm good. He's not brushing his teeth. I'm I don't know. It's
a big no.
It's what? She's saying in the morning he wakes up too late. He has to rush for his classes and he's like, oh no, I'm getting late. I'm like, really? I'm going to ask Dr. Nisha for sure.
Yeah, no, mouthwash alone is not at all enough. Brushing is very, very important. Yeah. Remember a little John? So the John is supposed to teach all the kids. Yeah. Yes, see, these teeth are going to be happy teeth and he can smile only when he has all his teeth, right? So it's very, very important that little John brushes and has all the kids brush their teeth every day, twice. Yes. Remember the first video?
Yep.
2 times a day, twice daily.
I remember.
At least 2 minutes.
I'm gonna make sure that she make her son watch this session for sure.
Yes, and mouthwash alone is definitely not enough.
Thank you so much for information. Thank you, doctor, for taking our time. Thank you, Junie. Thank you so much. Thank you for being part of it.
Thank you, Rashmi. Bye.